Hi, everyone. I'm Olga Villaverde, and welcome to this Smart Life special, a town hall discussion about the COVID-19 vaccines. The Health Channel is here to answer all of your questions. But first, I'd like to introduce our fabulous panel today. We start first with Dr. Alan Feingold, Medical Director of Occupational and Environmental Medicine at South Miami Hospital, who is both a pulmonary specialist and an epidemiologist. He's been reporting to the hospital community on the COVID-19 epidemic every day since March. Also joining us, Dr. Handel Robinson, Associate Professor of Surgery in the Division of Vascular Surgery at the University of Miami Miller School of Medicine. He is a practicing surgeon and a highly respected author and lecturer. Next up, Dr. Tina Carroll Scott, the Medical Director of the South Miami Children's Clinic. In addition to being a pediatrician, Dr. Scott has a passion for identifying health disparities in our communities. And finally, joining us, Dr. Frederick Shaliff, an interventional cardiologist who practices in Western Broward County. I want to welcome all of you and thank you so much for your time.
Thank you. Thank you, Olga. It's a pleasure to be here.
Thank you.
Pleasure to have you. Before we get started, and I know it's going to be a valuable discussion, I want to remind all our viewers that if you'd like to send in your questions to any one of our experts, please do. Just send it in the comment section below on Facebook and YouTube, and we'll be sure to get to them as soon as we get them in. Okay, so a lot to talk about. Let's talk about these vaccines, obviously. Shipments of the Moderna vaccine already started. Hundreds of thousands of people around the world have already received the Pfizer vaccine. President-elect Biden and his wife were vaccinated today. Vice President Pence was vaccinated last week. So Dr. Robinson, I'm going to turn to you because I believe we have a photo of you being vaccinated as well last week. Let's see if we can show that picture to our viewers. And there you are with a thumbs up. I'm seeing a lot of thumbs up from so many people who get the vaccine. Tell me how it went and what did you feel?
No, well, it was a very easy, painless experience. Actually, it was less painful than even the flu shot that I had earlier this year. After having the vaccine, I did have some soreness along the muscle, which probably lasted for about 24 hours. But that was really about it.
All right, Dr. Feingold and Dr. Shaliff, I believe you two also received the COVID vaccines. Dr. Feingold, let me start with you. How did it go and how safe is this, sir?
Well, it's a very safe vaccine, one of the most intensely studied vaccines that have been introduced in the history of vaccination. I personally had no symptoms or discomfort, and I was overwhelmed by the incredible organization, Baptist Health System. I received it there where I work, and we were just all of us so happy to be giving the vaccine and receiving the vaccine. It doesn't hurt, and you feel fine the next day.
I've seen a lot of smiles when the vaccine arrives at hospitals around the country. It's almost like an amazing event that happened. It's almost like a miracle has arrived. Dr. Shaliff, you received it. Any symptoms with you?
No, I felt fine. It was pretty much uneventful. Again, a little local muscle soreness. We were observed for 15 minutes after the injection just to look for any side effects. And I could say while I was there, nobody had any side effects. And of the people I spoke to afterwards, it was uneventful for most everyone. And we were very elated and happy to get the vaccine to do something to mitigate this process.
Absolutely, Doctor. Dr. Scott, do you plan to receive the vaccine?
I do plan to receive the vaccine and hopefully within the next few weeks. Yes.
All right. So I want to talk more about the vaccine. Dr. Feingold, extensive research, like you just said a few minutes ago, on this vaccine. Talk to us about when the research began and why we should trust it. I think a lot of fear is it was so quick. So your words, please.
I think it was indeed very quick, but you should understand that the people who worked on this vaccine have the advantage of incredible scientists who've been working on messenger RNA vaccines for approximately the past 10 years. So this concept was introduced previously and then brought to bear with tremendous effort, a nationwide effort something extraordinary, something that was, in fact, supported by the Department of Defense, by the White House specifically, by the efforts of many people. And I must tell you that I'm extremely proud to be part of the medical community that has worked together to produce this vaccine.
And I have a question from a viewer, and I want to get to it immediately. Tori asks, if the vaccine raises your blood pressure? I actually appreciate that question because I have blood pressure issues as well. So thank you, Tori. Dr. Robinson, can you take that for us?
There's no indication that the vaccine raises your blood pressure. The vaccine has been well studied. These two trials that were carried out by Pfizer and by Moderna were trials of very high quality data, went through all the different steps of a research trial from level 1, 2, and 3. And there's been no evidence of any hypertension being caused by the vaccine. What we do know are some of the reactions that we can have from having a vaccine done, which is, and a reaction is really just the body reacting to having a foreign agent in it. And that is expected. That's what we want from a vaccine, to stimulate our immune system. So folks can have complaints such as myalgia, they can have nausea, they can have fevers, but there has been any report of hypertension.
And Dr. Shaliff, obviously as an interventional cardiologist, are you hearing this from patients as well? Do they come up to you and say, I'm concerned about my blood pressure?
No, no one's really had a concern. If anything, if they get the vaccine and sometimes we see a little acute elevation, I think it's more from the stress anxiety of receiving the vaccine than it is a hemodynamic effect of the vaccine per se. So nobody's been really worried about a blood pressure side effect of the vaccine.
And Dr. Scott, you and I were talking just before our town hall began, and you really were very vocal about your patients. They're a bit fearful of it. Talk to me about that. What are their concerns?
For me, I think, if I'm going to be honest, I think there were a lot of missteps with the vaccine production and rollout. And what I mean by that is even starting with the name alone, Operation Warp Speed. That name invokes fear, and people automatically assume that it's being rushed and that steps are being skipped, and therefore the vaccine must be unsafe. And I think once that type of sentiment is expressed over multiple social media platforms, it's really difficult to put the genie back in the bottle, so to speak. So I think in some ways we missed an opportunity to start having critical conversations in these communities who are fearful early on, and educating them about the vaccine trials and educating them so that they could make more informed decisions about whether they should take this vaccine when it becomes available.
Dr. Feingold, can you chime in on that? Because again, that's what I hear the most. I hear from everyone, Operation Warp Speed, it was too rushed, it can't be safe. Dr. Scott is obviously hearing that as well. What would you say to that, sir?
I agree with Dr. Scott that the emphasis on the speed with which this was accomplished does cause people to have some concern. But in response to it, what I would like to tell people is that the speed is a result of the compression of the work that normally takes years. There were no shortcuts. It is valuable to look at the results that have been published in the New England Journal of Medicine, and also that are available in the briefing document. That's the Food and Drug Administration briefing document. This is entirely transparent. We know what these vaccines do. We know at a biological level. We know in terms of the epidemiology. They've been incredibly studied and published. So it's not just talk. It's publishing in the peer-reviewed medical literature. And I can tell you that we all of us, have every reason to have confidence that this was done correctly, without cutting any corners, while protecting all of our fellow citizens, and we're ready to go. We're ready to stop this epidemic, which in fact will terminate approximately 40 days after we achieve a herd immunity or community immunity of about 45 to 60%. That's anticipated to occur in April. But we all have to get on board. This will not only save our lives individually, but save the lives of our fellow citizens. So this is a fantastic event, and it's a safe activity to take this vaccine.
You know,
Can you
Oh,
imagine?
can I chime in for a second?
Absolutely. I have many questions coming in as well. So
Okay.
I think Dr. Robinson, do you want to say something?
Yeah, no, I wanted to piggyback off what was just mentioned that and this is not the first coronavirus that we've studied. So we've studied coronavirus that causes SARS and also causes MERS, and particularly using the mRNA technology. So the framework and the engine to get this vaccine done quickly was already established, and this COVID-19 presented the opportunity for Operational Warp Speed, if you will, utilize that framework to get this vaccine done quickly. But as mentioned, all the correct steps were taken. All the different phases of the research trial where it was carried on, no step was missed in order to get this vaccine to production.
You know,
Thank you for that, Dr.
expand.
Robinson.
Okay, can I say something? Go ahead.
I just want to expand
Absolutely.
one thing.
Let me have.
The concept of messenger RNA as a vaccine has been known since about 1989. The speed of which this virus, of which this vaccine came to market, part of it, like Dr. Feingold said, was the data acquisition, that we had the information very quickly, and no steps were really compromised in the process.
And Dr. Scott.
Yeah, so I just wanted to say, even as a physician, I myself did not know a lot about messenger RNA. And so I had to educate myself. I called everyone I knew, my physician colleagues in different specialties, to get the information that I needed in order to make an informed decision. And so I think for a layperson that does not have those resources or connections, that we, I think as physicians, we need to show some compassion and empathy when it comes to the mistrust and fear that a lot of Americans are feeling right now in regards to this vaccine, because the information on social media, it is relentless. And and I think because we did not get ahead of the messaging beforehand, that there's just so much out there to try to educate now and retract that. It's going to be difficult. I mean, we definitely have to do it, but I think I wanted to say that it's not only lay people. I mean, there are a lot of physicians who also had some hesitancy at first because they weren't educated about this.
And that's why I think it's so important to have these conversations, especially as town hall. I have so many questions from our viewers, so I'd like to get to them. I got one from Maggie. I have one from Debbie. So Maggie wants to know, if you have had COVID, do you need to be vaccinated? Dr. Robinson, I'm going to give you that one.
Well, the current consensus, if you will, because we've never been in this situation before, but the current consensus is that if you had COVID-19, within 3 months after having COVID-19, you probably should be vaccinated. So there is the current consensus and guidelines that we're suggesting that folks, if you've had COVID, 3 months later, you probably should still be vaccinated, because we're not sure how long the immunity from being infected with COVID-19 will last.
All right, Dr. Feingold, I'm going to give you this question. It's from Debbie, and she says, if you have lymphedema in one of your upper extremities, can you still get the vaccines? I understand that you are supposed to get the first shot in one arm and the second shot in the other arm, or can you get the second shot in a different body part? Dr. Feingold?
Well, first of all, if you have lymphedema, that's typically the result of prior breast cancer surgery. But if for whatever reason, it's much better to have the vaccine. In fact, you must get the vaccine in the other arm. There's no reason not to get the second dose in the same arm. If necessary, the vaccine could be given in the hip. So there should be no problem. A person with lymphedema can proceed anyway.
All right, I have another question from a viewer. For the autoimmune disease and severe allergies, absolutely. If you have autoimmune issues or severe allergies, Dr. Shaliff, can one get the vaccine?
Well, actually, this is probably a very good question for Dr. Feingold. But again, it depends on the extent of the illness, what medications are on. Now, if somebody's immunocompromised, they have to speak with their respective physician to find out. But again, I still think if they can take the vaccine, they should. Severe asthma is one of the high-risk patients. We see people with mild asthma not to be as high risk as a moderate to severe asthma type patient.
And Dr. Feingold, I'm going to have you chime in on that question, plus this one as well, if you don't mind. Cheryl also asked how these vaccines affect those who have autoimmune issues and severe allergy questions.
Okay, so there are two issues. One is patients who have immune disease such as rheumatoid arthritis, systemic lupus, scleroderma. These are serious illnesses which are nowadays treated with a variety of medications, including steroid, methotrexate, and certain biologics. These people who suffer from these diseases may or may not be at increased risk from COVID-19, but the consensus on this issue is that they should be vaccinated. The only caution that the FDA has voiced about this is that the vaccine may not work as well in a person who has one of these immune diseases. I think it will work, but certainly people with one of the immune diseases should receive the vaccination. Regarding the question of allergy, much has been made out of this, but in fact, there have been only a few cases of severe allergic reaction recorded anywhere in the world. This is not shocking. Sometimes happens with vaccination. There have been a couple of cases, perhaps 3, out of the hundreds of thousands of immunizations that have been given, where there was anaphylaxis, which is a severe and dangerous form of allergy that occurs within a few minutes. The medical facilities where vaccines are being given are set up to treat that, which is really pretty easy if it's done quickly, and everybody who's had that has recovered, but that's not something really to worry about. The only issue at this point, there's a simple way of looking at it. If you have an allergy that requires you to carry EpiPen for treatment of severe anaphylaxis, then you can still get the vaccine, but that you need to be watched specially by your doctor. You should discuss it with your doctor. So I think that allergy, including asthma, and even a history of anaphylaxis may not exclude, and the FDA does not say that it excludes vaccination, but it requires special involvement by your doctor.
And I just want to remind our viewers, if you have a question for our experts, please put them in the comment section below and we'll get to them. Just like Larry did, I have a question from Larry. Dr. Robinson, I'm going to give this question to you. He writes, I'm confident about the clinical trial process and the information about side effects. My question is primarily related to the where and when of the vaccine. Do I and others wait to be notified, and how will that happen? I live in Palm Beach County and need to be confident on next steps.
Yeah, so and the vaccine rollout is very important because as it is, we're limited in supply in terms of being able to administer vaccines to as many people as we want them. The issue is who gets the vaccine first, and the CDC and the WHO and the government has looked into this, and the consensus is that we approach it via a tiered manner. So as it is right now, healthcare workers and those who are in the front line are the ones who are being vaccinated first, and the next tier after that will be adults greater than age 75, and those that felt to be at high risk, and also essential workers, and then below that there will be adults greater than 65. So I think depending on your age group and also depending on your risk profile, it's okay to stay tuned to the news, but also reach out to your primary care doctor for more information as to when you should be notified about your being a candidate for the vaccine. But we're being very transparent about the tiered approach and staying tuned to the news and what's coming from your primary care doctors will help to guide you.
Dr. Feingold, I have a question that Liz poses, and it's a question that I get from a lot of my friends because they know that I obviously interview many doctors, and I'd like to have your take on this one. Can someone explain the science and differences between the Pfizer vaccine and the Moderna vaccine? Which one is better? And that's from Liz, Dr. Feingold.
Right, that's the question I've already been hearing as well. We've addressed this in our nightly reports, which incidentally anybody can sign up for if you want them. We've been generating these nightly reports since March. The answer to the question is that the two vaccines are both messenger RNA vaccines. They are not adenovirus vectored vaccines. Those are coming, and those will be very good too. But these two vaccines are extremely similar. There's some differences in manufacture. There's some differences, minor differences in distribution, logistics. But the two vaccines basically do the same. The data from the very extensive research on these two vaccines is, reveals practically superimposable results. So I think that a person should get whichever vaccine is first available to them. Please note, you should not switch. If you get Moderna first, you should get Moderna second 4 weeks later. If you get Pfizer first, you should get Pfizer second 3 weeks later. So stick with that type. Either one will be very effective and safe. And one thing I want to mention, one more thing I want to mention, which is I think that there will be a lot more vaccine availability than people are talking about generally. I think that, and the Institute for Health Metrics Evaluation, which we've been talking about a lot, also thinks that we will be able to achieve a tremendous amount of vaccination, assuming that people accept it, as early as April. So I think that within a few weeks, there will be a lot of vaccine.
Olga.
As soon as April.
Yeah.
Yes,
I just want to expand a little bit on the difference. They're both messenger RNA vaccines. One of the major differences between the two is the lipid nanoparticle that the messenger RNA vehicle is in when it's given as the shot. They are a little bit different, which does account for the differences in the temperature when it's distributed and the duration that it stays in the shelf or the refrigerator. But the messenger RNA is the same. The preservatives that are in there are different, and the lipid molecule that is transported in the messenger RNA in the shot is slightly different. That's the only real difference.
Thank you, Dr. Shalif. Dr. Scott, let me bring you in. We're hearing so much explanation about the vaccines. You and I spoke earlier before we started the town hall about, again, the mistrust. I am Hispanic. I hear a lot of mistrust in my community. I'm also hearing it from the African-American populations. Do you believe the education we are getting, even right now during this town hall and in the months to come, could help make that turn from mistrust to trust?
Yes, absolutely. But I don't think it's going to be a one-time deal. I think, we are going to have these ongoing conversations. The mistrust with the African-American community as well as the Latino community I think it stems from the fact that these two groups have never felt that the federal government has really looked out for their best interests when it comes to economic or healthcare policies that would benefit them. So now you have the government saying that they want to prioritize these communities when it comes to the vaccine rollout. And people are like, whoa, wait a second. You've never really cared about us. And now all of a sudden we matter and you want to give us a new vaccine, which they see as rushed and unsafe. And I think there's a natural tendency to push back and to say, no, we're not going to be, for lack of a better term, guinea pigs with this. And with the African-American community, it's even more complicated because there's a long history of medical experimentation, and that also fuels mistrust. So the dilemma that we're dealing with right now are that two things are true: that there's been medical experimentation in the Black community, but there continues to be healthcare disparities that exist today. But Black and brown people are being affected disproportionately from this virus. So how do we reconcile these two things? And I think first and foremost, we're going to have to acknowledge that these truths exist and validate the fears that people have. and show compassion and empathy and educate. I think having ongoing conversations about this vaccine and modeling the behavior that we want to see. So that starts with physicians in these communities getting the vaccine, other community leaders, pastors, local politicians, so that people that they trust and admire, will instill the confidence that they need to trust that this is safe. So I think what my ultimate goal is for my patients, and especially my Black patients, is for them not to get victimized twice. First with medical experimentation, and then second by exclusion, by not getting this valuable vaccine. And so it's going to be a delicate balance.
Dr. Feingold, I have a question from a viewer. She didn't give a name, but she has some fears and concern, just like Dr. Scott has expressed with her patients as well. My stepmom is extremely allergic. Her doctor told her she should not get the vaccine. We talked about allergies already, but I do want to pose the question again because she did write this question in. Is that the case for most people with allergies? Once again, her doctor told her she should not get the vaccine.
Well, I think her doctor should reconsider the advice. When we're talking stepmom, I'm guessing the mom is older than 55, maybe older than 65. All vaccines have the potential for inducing some allergic response, partially because there is a carrier or a filler in vaccine, which often is, and is in this case, a polyethylene glycol, which is something that people use for as a laxative, and some rare people are allergic to it. So it's conceivable that some rare people might develop an allergic response to this vaccine. But saying that a person is allergic, which generally means that they have allergies to foods or medicines or something like cat dander, that is not a contraindication to this vaccine, which may very well save the life of a person who is older than 55. So there are risks associated with every medication. There are terrible risks associated with this disease. I think that it's possible to take special precautions for patients who are have multiple allergies, but generally speaking, they should get the vaccine.
As we always say, risks and benefits. In this case, you believe there are more benefits than risks. In other words, the benefits outweigh the risks.
Oh my God. Doctors, all of us, I know I speak for all of you, that we always, every single time we write a prescription or every time we even order an x-ray, we consider risk versus benefit. It's like a fundamental part of being a doctor. On this occasion, this is sort of an easy one, right? Now, not necessarily for children. Not necessarily for children. Children don't get really sick, not for the most part, but some children with developmental diseases or who have malignancies are at great risk. So those children should probably get vaccinated, although this vaccine is not yet approved for them. But this is an easy call. The risk-benefit ratio is very favorable.
Dr. Shaliff?
Yes. Oh, I agree. I mean, when I see my patients, we look at the overall condition, and this is very simple. The benefit far exceeds the risk, in my opinion, as well.
And Dr. Shaliff, many healthcare workers, I understand, are kind of bypassing their opportunity to get the vaccine. Shouldn't they be first in line? Your thoughts?
Many of the healthcare workers, it depends. Some of them are on the front line. I mean, we've even seen people, of course, that clean the rooms after the corona patients have left. All the first responders, yes, all those professional physicians and the supportive personnel should be vaccinated. But they're the ones that are exposed. Even the environmental services, they're in the room cleaning the patients. They need to be vaccinated because they're the ones that are at high risk as well. And some people, again, like you mentioned before, they're afraid, so they decide to wait. The biggest thing I hear is, well, I want to see what happens to everybody else before I take the vaccine.
Yeah.
And that's not what you want to hear. I said you don't want to wait and then come down with the illness.
And I've heard that as well. I'm just going to wait like 6 months and see how it all pans out. And then I'll make my decision. Dr. Robinson, have you heard that as well?
Oh, absolutely. I've even some of my colleagues who, as mentioned, who are physicians themselves. There's this concept of hiding amongst the herd, meaning that everyone else will acquire immunity while you hope to escape not being afflicted with the coronavirus. But I think that'd be a fool's errand. I mean, the mortality of coronavirus is so high. It's a 1% or 2% mortality in the medical arena is quite high. I oftentimes tremble if I have to offer a patient an operation with a 1 to 2% mortality. So to think that you would run the risk of having coronavirus and bring that mortality upon yourself, I think it'll be a fool's errand.
Yes,
Dr. Scott, I was actually going to follow up with that because my thought was, well, would one be more fearful of getting it in terms of the COVID-19 or more fear of getting the vaccine? I'm going to speak just personally for me. I'm more fearful of getting COVID-19.
Yes, and that's the conversation that I've been having with patients. Which unknown, do you want to deal with? And I would prefer to, taking a vaccine that's been well researched than getting, COVID and not knowing what could happen down the road. So I think that analogy has actually been working to a certain extent, but I 100% agree with that.
And Dr. Feingold, I have another question here, and this is about dosing in terms of the days that we're supposed to take the second one. So I love this question from Arturo. Does the timing of the second dose have to be exactly at day 21, which is with one vaccine, and I believe it's day 28 with the other? Does that have to be exact?
So the FDA has specifically spoken to this. There is a grace period of 4 days before. And the FDA has said also that if the second vaccine is missed, so day 21 comes along and the person doesn't go because for some reason, the second dose should be given as soon as possible. And the course, meaning the 2 vaccine course, does not need to be repeated. So simply, you could safely get the second dose up to 4 days before you're supposed to. And if you miss the second dose, get it as soon as possible.
I have a couple of follow-up questions to that, Dr. Feingold, and forgive my ignorance here, but I think it's a very basic question that anyone would ask. What if someone just totally forgot to do the second dose? Is there any immunity built up in there?
First of all, I would comment that physicians generally love questions. What we don't like is when people don't ask questions and there are no bad or stupid questions. Sometimes they're bad answers, but there are no bad questions. So in response to your question, the answer is that yes, there is immunity. The nature of the immunity, the way of solidifying the immunity may be very important in COVID-19. But generally speaking, if a person misses the second dose, they will have significant immunity despite that. One scenario could be that the person falls ill with something else, and they're not eligible because of that other illness to get the second dose, but they will still have significant but not adequate protection.
And I have one more question.
Can I chime in for a second? Okay.
Absolutely, Dr. Scott, go ahead.
No, I just wanted to say, I think what's missing in this conversation too is really giving credit to the tens of thousands of volunteers that signed up for both of these studies. Over 80,000 volunteers that participated in both the Pfizer vaccine study as well as Moderna. And and I think when I think about that, the fact that they did not have any information about possible safety, but they decided to do this because they were selfless and because they really wanted to advance science and put an end to this pandemic. And so, we have, I guess, the privilege of seeing this data from these selfless individuals over the last few months and make an informed decision. So if all of these tens of thousands of volunteers can do that without any information, I think we owe them at least that to say, listen, we thank you for the sacrifice that you made, and for the betterment of our society and putting an end to this pandemic.
Absolutely. And there is so many thank yous to be said throughout this last 10 to 12 months with frontline workers, hospital staff, so many people to say thank you to, so many people that have truly, truly sacrificed so much. Thank you for that, Dr. Scott. Dr. Feingold, I wanted to ask you also regarding the vaccine. Will this be a once a year vaccine like we do, for example, with the flu? Or is it like a tetanus shot that we do sometimes every 10 years or so?
10 years. Right. So currently, based on the data that's been accumulated and published, we simply don't have the answer. I think based on the underlying nature of the vaccine, that is that the vaccine is an mRNA message to internal factories and cells, and then the long-lived bone marrow-based T cells that will maintain a immunological memory. I think that it's very possible that this vaccine will actually be a lifetime vaccine, but we don't have that data yet. So currently, we don't know the answer. It may be necessary to get a booster like tetanus. Tetanus is a good example, because that's every 5 to 10 years, depending on exposure. So it may end up being like tetanus, or more like measles, which provides 97% immunity for a lifetime after the disease or the vaccination. So I anticipate that this will be a long-lasting immunity, but the data is not yet available.
Okay, fair enough. I do want to remind our viewers again, if you're watching and you have some questions for our experts, please send them into the comment section below and we will get to them as soon as possible. Dr. Robinson, I did want to talk about a little bit about the early issues with the first large-scale vaccinations. How will they be addressed? And if someone were to have any issues, which honestly we haven't really heard of much. You expressed some soreness. I think Dr. Shaliff really didn't have much of any symptoms, or Dr. Feingold. But what should one do?
Well, if one were to have any symptoms, so keep in mind what the expected possible symptoms of having the vaccine are. As mentioned, one can have muscle soreness,
we're having some
fatigue. Am I there?
I think we can hear you now, Dr. Robinson. So if you could start from the beginning, and now your audio is working. Thank you, Doctor. Forgive us. Technical issues with, this new way of living.
This new way of living, absolutely. No, as mentioned, it depends. So one should keep in mind what the known side effects of or adverse reactions to the vaccines are, or the common ones. The common ones are soreness at the insertion site. One can have myalgias with the generalized muscle aches. One can have fatigues, and even nausea that has been reported in those 2 studies. And if one were to have that, oftentimes these things are self-limiting. And usually within 24 to 48 hours, it should go away. If it hasn't gone away, then of course you should contact your primary care doctor. In terms of the early distribution of the vaccine, a lot of challenges are, but I think the system has done a very good job of compensating for that. One is the issue of supply, the issue of how do we disperse a vaccine that needs to be kept at below freezing temperatures to the public. And I think they've done a good job of identifying primary delivery centers and secondary and tertiary delivery centers, and also tiering their approach as to who gets the vaccine to make sure that the demand and supply match up as we look to curtail the mortality and the morbidity of the virus.
And Dr. Shaliff, you had expressed to us how you had no qualms getting the vaccine. Do you share that with your patients? And if you do, which I'm sure you do because you're very passionate about what you do, Do you find that they feel a little bit more comfort when you tell them, hey, I did it, you should too? Does it open the door?
Yes, they really feel comfortable knowing that I've got it, or I had it, the vaccine. And they also feel comfortable that if your doctor feels comfortable to take it, he understands the process, and I should
Yes.
do it as well. And I'm seeing a lot of people who are older with heart disease, coronary bypass surgery, diabetes, hypertension, a lot of medical illnesses that really need the vaccine. And yes, they are reassured that I've got it, I did well, I explained it to them, and they feel comfortable. And I think moving forward, they would definitely want the vaccine.
Dr. Scott, you
I'm
were going to say
actually
something?
going to I'm going to piggyback on that, because literally every single patient is waiting for me to get this vaccine, and they've all told me, when we see that you get it, and not only do you get it, but you're willing to give it to your family, to your kids, then we'll get on board. So I 100% agree with that. And they know that I would never recommend something that I wouldn't do for myself, or recommend to my own family members. So yes, so stay tuned.
You know, one of
And
the
that's
first
why
things
I
they
asked.
asked me, one of the first things they asked me, well, did you get the vaccine?
Yeah.
When they come in.
Yeah, no,
I think there's a sense of relief.
Yeah.
Yes.
I worked with my father, who is also, by the way, Dr. Robinson, a vascular surgeon. And mind you, never had I experienced what we have experienced in the last 10 months. But I would always hear the patients, so doctor, if it was your daughter, would you be doing the same thing? And I think, yes. And I heard that so many times in my father's clinic. And I think, Dr. Feingold, it helps, again, just give that peace of mind. You know, doctor, you did it, so you think my children should get it? And I think that's maybe how we can start getting the ball rolling, as we say.
Yes.
Well, I think that there's
you know, I could say one thing was very funny. When nobody wanted the vaccine, and then when we got it in the hospital, and some people started to run and get it, then everybody, it was almost like a herd effect, and everybody else wanted to run and there was a comfort level. Well, if he's getting it, I should get it. Well, if he's getting it, then I definitely want it. So there was a comfort level with a lot of people getting it. Everyone said, you know, it's probably the right thing.
I agree. I think you know, what will happen is that we'll get to a point of a critical mass of folks getting it and seeing everyone else get it, and that's when it will really ramp up exponentially. So I think the fear that folks will not be vaccinated, we will not achieve herd immunity, is probably too early to tell. I think with social media and folks you know, posting that they've gotten the shots, and also senior leaders getting the vaccinated, as Dr. Scott has mentioned, will do a lot to get this ramped up.
Absolutely. Dr. Feingold.
I was going to say, I really agree with Dr. Robinson. There's a critical mass, you know, once people start seeing it. And also there's the long-standing issue that physicians have a duty to act as an example. I mean, many years ago, decades ago, doctors were among the first people to stop smoking cigarettes. It was important to tell our patients that they shouldn't smoke, and that they could see that we ourselves, as a group, as a profession, had stopped smoking. So there's an issue of example, and there's an issue of critical mass. One more thing. As physicians, we were very worried about acceptance, you know, patient acceptance, that hoping that people will accept taking this vaccine, both for their own safety and for the community safety. Two different things, not necessarily exactly superimposed. But the data that was published 2 days ago suggests that there will be a very good degree of acceptance nationwide. It is different in different states, but the anticipated degree of compliance or acceptance with the vaccine ranges from between 60% and 80%. This is in published data. So I think it's going to be, once we get it rolling and once there's a critical mass, the population will accept the vaccine, and we will be able to bring this very bad chapter to an end.
Amen to that. I want to get to herd immunity and explain it a little more for our viewers, but I do have a question from a young woman who writes, my stepmother is in her mid-60s and is in remission from leukemia, and her doctor says she should not get it. Dr. Feingold, could you respond to that?
Well, I'm not this patient's doctor, and I don't know what's going on at the bedside. And I always defer to the doctor at the bedside. Maybe this patient's doctor knows something that I cannot possibly know. But having said that, I question the advice. I think that the only risk for such a patient, generally speaking, is that the vaccine won't work. Not that there's something dangerous about the vaccine.
All right, thank you, doctor. We hear a lot about herd immunity. I know it's what we want to reach. Dr. Robinson, a viewer asked, what is that and why is it so important?
So when we think about vectors or pathogens, there's a particular rate to which it spreads within the community. And what herd immunity does, if the majority of the population or a certain percentage of the population, depends on it depends on how infectious the pathogen is. For some pathogens, the herd immunity, if you will, needs to be a lot higher. But herd immunity means that a good portion of the population is immune to the virus, and because you are immune to the virus has nowhere to spread or go to. So the virus needs a human host to replicate and then spread. But there's no human host because most folks are immune to it. Then the virus can't replicate, the virus can't spread, and it ends up dying out in the community. So we think for COVID-19, we're looking at somewhere between 60 and 70% of the population being immune to the point where there's not enough hosts or vectors for the virus rather to replicate and pass through the community.
I'd like to ask a question to all of you, but go ahead, Dr. Shaliff.
I do want to, there's one question I frequently get asked by my patients, and they say to me, if I had the vaccine, do I still have to wear a mask? And I get that all the time, and I tell them yes. But, people tend to think once they get the vaccine, they will never get the illness. And they do have to understand they have immunity, but they theoretically can still get it. It may be very mild, but it may be asymptomatic. But it doesn't 100% prevent that they would never get the illness.
And you read my mind, Dr. Shaliff, because I was going to bring that up, but I do have a question that I want to get to from Arturo. And Dr. Feingold, I'd like you to address this. He kind of wants to know, great question here, why the vaccine has to be kept so cold. Here's Education 101 now.
Right. This is a technical issue, which is not epidemiology. It has to do with the manufacturing process and with the stability of this little tiny segment of messenger RNA within the special lipid, which is a kind of fat molecule that surrounds it, that just so happens to be capable of delivering the messenger RNA into the cell. At higher temperatures, and now the vaccine can be kept at normal room temperature for a short time, but at higher temperature, the lipid, the fat that surrounds the mRNA, starts to come apart. So it has to be protected from cold, at least during transportation.
And following up now on Dr. Shaliff, because I would have a question from a friend of mine that comes in handy now with your statement, Dr. Shaliff, about masks. And I was reading here, and let me see where I put it. Some research from the University of Washington, which Dr. Feingold is exactly what you've been telling us, that suggests these vaccines could perhaps end the pandemic, maybe even by April. So, Dr. Scott, again, April 2021. I know you're a bit skeptical about it, but it is a wonderful, amazing thing to be able to think that by April,
it would be great.
Yeah. It would. Are you having also patients saying, would that mean the masks are over or free?
Yes, they actually think that we are going to go back to pre-COVID, and no more social distancing, no masks, no hand washing. Yes, so I am hearing that, and I've had to educate them about that as well, that it's going to be a little bit longer than that, but we will get there, but it's not going to be immediately after you get vaccinated.
Dr. Feingold, I'm curious as to what your answer is.
So I would comment briefly on what Dr. Robinson said in terms of herd immunity, which is a classic, classic epidemiological concept. And I agree exactly with what he said, except for one thing, which is I do think that given what's considered the time varying reproduction number of this virus, and not to get into a long discussion what that means, it means how contagious it is, how easy it is for one person to give it to another person. So we know what the basic reproduction number of this virus is, and that allows us to mathematically calculate what the degree of herd immunity needs to be. There are certain unknowns because of the amount of human-human interaction, especially among different portions of the population. So the most recent evaluation of this issue suggests that, in fact, we only need to achieve somewhere between 45 and 60% immunity within the society. And don't forget, that is including the people who've had the infection. So right now, the IHME, which is the Institute for Health Metrics Evaluation, which has been providing us with hugely important information during this epidemic, the IHME estimates that nationwide, and it varies in different states, but nationwide, 17% of the US population has already had COVID-19. So we need to add not that very much to the 17% to get to 45 to 60% immunity, at which point mathematically we are reasonably certain that the epidemic will precipitously end, which doesn't mean that nobody can get the disease. So in certain circumstances, especially in crowded venues for a while, maybe a year, it will still be advisable to wear a mask.
And Dr. Scott, a lot of parents, even myself, every year my kids go to the pediatrician to get those shots that we have to get. Talk to me about vaccinating children. What are your thoughts? What are you telling parents? Because right now the vaccine is voluntary. And should it stay that way?
Yes.
That's another question. Should it stay that way?
Okay, so for right now, with the Pfizer study, they actually did enroll kids down to age 16, and with Moderna, it was 18 and up. So they are actually expanding that, and I believe now, and if anyone has additional information, it's from age 12 to 17. But they are not studying the younger kids. The American Academy of Pediatrics is really pushing for kids to be enrolled in these vaccine studies. I think kids have suffered greatly during this pandemic with not being in school. A lot of children did not do well with distance learning, and for some it was a completely wasted year. So I think the sooner that we can get kids vaccinated and back in school and learning, and also from the social aspect. I think that the past 10 months has been really difficult for me as a pediatrician. I'm probably seeing maybe 10% general pediatrics, and the rest of it is mental health, which is not what I was trained to do. But the level of depression and anxiety that we're seeing in children is really, it's off the charts right now. And so I think the sooner that we get the data that we need from kids so that we can start vaccinating children, the better. Ideally, it would be great if by the next school year, if we had kids back in school.
Absolutely. I think everybody wants that. Thank you, Dr. Scott. I have a viewer question. Dr. Robinson, I'm going to give this one to you if you don't mind. Debbie writes, do you think we could stamp out this similar to how we eradicated smallpox?
I think it's quite possible, and again, it depends on how how efficient we are at getting folks vaccinated. So that is really the key. And the reality is that if we achieve herd immunity above the 45 to 60% as stated, and herd immunity is in the 80s and 90%, then it's quite feasible that that we can eradicate this vaccine as much as we did other pathogens in the past. One thing to keep in mind of, which is recent news from the UK in terms of mutations of the strain, and the strain being more infectious, meaning that the R value is now gone up for that particular strain in the UK, which could mandate a higher herd immunity, if you will. But it is quite possible, if we're able to efficiently vaccinate the population, that we can eradicate it.
And as we wrap up this amazing hour, and it's been so informative, I kind of want to ask all of you, and we only have a few minutes, just some final thoughts as we wrap this up. Dr. Ferguson, I'm going to start with you in terms of just advice to families who are skeptical, worried, not sure of 2021. What would you say?
Well, I think that we are seeing the beginning of the end of this problem. I think that we should all, individually and as a nation, be tremendously grateful to all of the scientists and the healthcare workers and all the other people who contributed to the development and distribution of this vaccine, and that we should be, in general, both proud of our nation and very hopeful that we will return to a much more normal life.
And my apologies for saying Ferguson, Dr. Feingold. That's what we call live TV. And you must acknowledge your mistakes.
It didn't bother me.
I'm far from perfect. Dr. Feingold, my apologies, dear. Dr. Robinson, some last words of advice?
No, I think we're definitely turning the corner. It's a testament to advancement in medical science. I think this vaccine rollout is probably one of the greatest scientific achievements in modern era for us as biologists or virologists and scientists. And I think the end is quite near. I think 2021 will be a much better year than 2020. And I think we should stay the course.
Thank you, sir. Dr. Shaliff?
I agree. We look at incredible things moving forward. I think 2021 will be a better year. I think as information becomes available, people will feel more comfortable. You need to speak to your physician. We will get through this, and you should definitely get that vaccine.
And Dr. Scott?
Yeah, again, I would tell people to stay the course with safety measures. We're almost to the finish line. And I think on a personal note, I would like for the American public to know that your frontline healthcare workers are tired. And I think, we're tired of seeing the human suffering and loss occurring in hospitals across the country on a daily basis. And I think people, they see us as superheroes, but in reality, we're human. And we're humans carrying out an oath that we made in medical school to do no harm. But we're tired, and I think with the current rate of infection, it's not sustainable long term. Hospitals all across our country right now are bursting at the seams with no ICU beds. And if you get sick, you may or may not get the same quality of care that you deserve, because the support systems that we normally have in place, may or may not exist. So I guess my message is, help us help you. Continue with the safety measures. Definitely get vaccinated when you have that opportunity, and let's end this pandemic as quickly as possible.
Amen to that. Thank you to all four of you. I do appreciate your time and for taking that Hippocratic oath, do no harm. Thank you.
Thank you all. It's a pleasure.
Thank you.
And thank you all for tuning in to South Florida PBS and the Health Channel. Ferguson.